next presentation is entitled Incidence of Postoperative Respiratory Complications in COVID-19 Positive Pediatric Patients Across 20 United States Hospitals, presented by Dr. Reiter from Lurie Children's Hospital in Chicago.
Thank you for the opportunity to present. We have no disclosures, and this work was done with the Pediatric Surgical Research Collaborative. At the beginning of the COVID-19 pandemic, all elective surgeries were halted. When things opened back up, everyone had to determine whether or not it was safe to operate on asymptomatic COVID-positive pediatric patients. In the adult literature, it had been described that asymptomatic COVID-positive adults had an increased risk of postoperative hypoxia as well as increased risk of mortality. This information informed policies in the pediatric population as well. However, some of the preliminary data suggested that the pediatric population did not have the same risk as the adult population. So our objective was to describe the rate of unanticipated respiratory complications among symptomatic and asymptomatic COVID-positive pediatric patients undergoing general anesthesia. This was a multi-center retrospective cohort study, including 20 hospitals across the United States, all from the Pediatric Surgical Research Collaborative. We collected data from March 12, 2020 to October 31st, 2020, in children less than 18 years of age and who had a positive COVID test within 10 days of general anesthesia, either 10 days prior or 10 days after. We excluded any patients who underwent ECMO for respiratory distress due to COVID. We defined our postoperative respiratory complications as everything listed on this slide, and it's anything from high-flow nasal cannula all the way to death. All 20 sites entered their data into a centralized REDCap database, and then we performed descriptive analyses for patient and procedure characteristics, t-test and chi-square as appropriate for outcome associations, and then we performed a stratified analyses for symptomatic and asymptomatic COVID-positive patients. We had 273 patients in our cohort, 61% of them were male, with a median age of 10 years old. 14% of the cases were considered emergent, 67% urgent, and 19% elective. As you can see here, the majority of the cases were performed by general surgery or orthopedic surgery. We had 27 children with postoperative respiratory complications. The most common was high-flow nasal cannula, and the second most common was pneumonia. These are not mutually exclusive. For example, a child with pneumonia may have also been on high-flow nasal cannula. We had no progression to ECMO and no death in our cohort. We found a statistically significant difference in symptomatic and asymptomatic COVID-positive pediatric patients who had postoperative respiratory outcomes or complications. Our symptomatic cohort, there was 30.8% of those children had postoperative respiratory complications, whereas only 8.8% in the asymptomatic group had respiratory complications. We then performed our stratified analyses to look at associations for case classification, comorbidities, ASA class, and BMI status. We found a statistically significant association for comorbidities and a higher ASA class in the asymptomatic population, but not in the symptomatic population. We also looked at BMI, and we found no association with postoperative respiratory complications in either the asymptomatic or the symptomatic group. Some limitations to our study was that this was a retrospective review. We had no comparison group of COVID-negative children. We had no standardized protocol for laboratory testing, although we did require it be a PCR, and our study was performed prior to the vaccine availability and the Delta and Omicron variants. In conclusion, postoperative respiratory complications in asymptomatic COVID-positive children are uncommon. When making guidelines related to asymptomatic COVID-positive patients, the low rate of postoperative respiratory complications can be considered and weighed against the morbidity of delaying surgery. Thank you, and I'll take any questions.
Virtual question, which we'll start with.
I'd just like to make note that there's a delay in virtual questions coming in, so if you're attending remotely, please try to get your questions in early so we can address them.
It was a really nice and timely study. I just was wondering, what's the rate of postoperative respiratory complications with other respiratory viruses?
So in the literature, it's hard to define, especially based on our definition, which was so broad of postoperative respiratory complications, but we found for other respiratory diseases or illnesses, it was somewhere between 7 and 10%, so about the same.
Hi, Heather Levy from Oklahoma. Thank you for your study. We've had questions about this at our own institution. My question is, did you find a difference in terms of length of operation and complications in your asymptomatic or symptomatic patients? Because that's something we've talked about at our institution, is if they need additional procedures, but maybe they're not emergent, maybe we don't do those if they were COVID positive, because we weren't sure what the outcomes would be. Thanks.
We did not look at length of operation. We did end up looking at the different procedures that were done. I did put a slide up here for the elective, let's see, so that you can get an idea. Whoops, we went backwards. So you can get an idea of what some of the procedures were. But most of these were considered urgent or emergent, and not a lot of them were elective, so we didn't look at the time.
We have another virtual question.
Question from the interwebnet Snapchatagram world from Shireen Na. Do you find a difference in outcomes between those who tested positive before surgery compared to those who tested positive after surgery?
We didn't specifically look at that difference because the vast majority of our patients tested positive on either post-op day 0 or operative day 0 or preoperative day 1. There was a very small amount of patients who tested positive after their procedure.
Okay, thank you very much.
Thank you.